much. And our final presenter for this morning is Kimberly. She's the caregiver for idiopathic hypoPARA patient.
Hi, everyone. Thank you so much for being here. My daughter Ellie was diagnosed with idiopathic hypoPARAthyroidism at age 8, when we wound up in emergency after her hands completely spasmed shut. We were blindsided. We were sent home with an order to take a ridiculous number of Tums and calcitriol, stating that that was all she was going to need to live a normal life. But that was wrong in so many ways. Every day became a battle. The Tums made her stomach hurt, and she refused to take them. Her calcium dropped, and we were back in the ER. We were switched to calcium carbonate capsules, but continued to have issues with compliance, stomach aches, headaches, spasms, fatigue, and paresthesia. The years have brought us to immediate care centers and the hospital several times. Finding a knowledgeable provider is very difficult. We've been dismissed many times by multiple providers, stating that her complaints of pain, fatigue, and general malaise could not possibly be related to her condition. But it is, all of it. What many physicians don't seem to understand is that even though her levels are considered stable most of the time, her quality of life still isn't good. Being constantly ignored is so frustrating that she has stopped telling the doctors, and me, when she's having pain. She states that she's used to it, and we can't do anything to help her anyway. A child should never be used to having chronic pain. No one should. At age 11, she began complaining that she couldn't concentrate in school and was having difficulty remembering information from class. Her grades slipped, and I missed the signs. With tears running down her face as she experienced paresthesia and laryngeal spasms resulting in labored breathing, we were back in the hospital. We switched to calcium citrate, hoping for better absorption, but the amount of pills was daunting. No child should have to take up to 15 pills a day. In the little over 4 years since diagnosis, she has taken over 18,000 pills. If that doesn't shock you, it should. It's unsustainable, and it directs our entire lives. We are constantly counting out pills, watching the clock, planning our entire lives around when she needs another dose, because if we miss one, it can be very difficult to pull her levels back up. We look for hospitals that are close by when we're planning vacations. We don't dare attempt international travel. There's a constant level of stress and worry that affects our entire family dynamic. There are no carefree or unplanned days. It's not just calcium. We have to monitor her levels of multiple things. It's virtually impossible to keep her levels of everything in the narrow ranges that are required for regulation, and she suffers because of it. New issues arose as a direct result of the amount of calcium that she's forced to take. Her kidneys started to struggle. She's had kidney pain several times due to probable kidney stones. Have you watched your child hunched over, clutching their side and crying in pain? I have. I cry with her because there's nothing else I can do. I hold her hand and try to distract her with funny videos during the blood draws that she needs at least monthly. I negotiate, I threaten, I beg, and I plead to try to get her to take her pills, to drink the right amount of water, to make the food choices she's supposed to make. I watch as her childhood slips by. She's too tired to play, to try out for sports, to run around outside with her friends, to just be a kid. She's old enough to understand what her condition is and to feel scared and alone. On hard days, she says she would rather be dead. Those words hurt me through the depth of my soul. I'm failing her. We are failing her. I can't fix this, and as a parent, that's the hardest thing to accept. There have been some positives. My beautiful daughter is stronger than I ever would have realized without this journey. She's so much stronger than me. Every day she keeps going, keeps moving forward. She's brave, kind, compassionate, and intelligent. She amazes me. We will keep praying for an intervention that treats the cause of her condition instead of just attempting to control the symptoms, something that will make a real difference in her quality of life. The current standard of care is insufficient, ineffective, and unsustainable. She deserves better. Everyone with this condition does. Thank you.
Wow, a lot there, right? Listening to all the stories. Thank you all. Very brave, very courageous, and we appreciate everything that you did. Let's give them another round of applause.